also that are being abused and that are abused because they kind of give the strong feelings of euphoria. So with that, okay, your addiction is kind of categorized by a high motivation to obtain and use the drug, that is without prescription, okay, despite the known negative consequences to the individual. And with time, what happens is that the use of those drugs, they become very compulsive. So that causes your both physical dependence,
Hell from the
physical dependence. Who's that singing? Okay, so what was I talking about was that certain drugs, they are abused, okay, and because this group of the drugs, they give the strong feeling of euphoria. And both kind of addiction, your physical addiction as well as your psychological addiction will be there, because it gives the high motivation to obtain and use the drug despite the non negative consequences to the individual. And as a consequence, with time, what is happening is that the use of the drugs becomes very much compulsive, okay, and that is landing up because of both the physical as well as the psychological dependence that the drug gives. Now, coming to the pharmacology related to the abuse relating with the drugs, what is more concerned here is that the repetitive exposure or your compulsive use, because of the compulsive use of the drugs, there will be repetitive exposure to this group of the drugs, and this will kind of induce uh, kind of widespread adaptive changes in the brain. And because of that, many more because of that, many more unwanted and acute kind of unwanted actions can be there, okay, and the drug use may become compulsive, which is your hallmark for the addiction. So we know that opiates is one of such group of the drugs which causes the addiction and has the addiction liability, abuse liability. And what we know from the pharmacology relating to the drugs of abuse is that your mesolimbic dopamine system, okay, this is a system which is mainly involved in the reward processing, okay. So this system called as the mesolimbic dopamine system, it is the prime target for the addictive drugs or the drugs of abuse. And as a general rule, all these drugs of abuse, they activate this mesolimbic dopamine system. Now, what is there is that since this is the prime target of the addictive drugs, so this system originates in the area known as the ventral tegmental area, which is also known as VTA. I hope you can see in the picture over there. Can you see there?
Yes, ma'am.
So this is the main area where your system of your mesolimbic dopamine system originates. So from this, okay, the project this from this area which is there in the brainstem, okay, it projects to areas like your amygdala, okay, and also in the hippocampus and nucleus accumbens. So this will be projecting various of the neurons in these areas, where most of these neurons, projecting neurons, are your dopamine producing neurons, okay. So main system that is being involved in the reward processing, which is the main target for your drugs which produces abuse, okay, and this is the one which is there. So this is called as your mesolimbic dopamine system. So as I've told you that as a rule, what is known from the pharmacological aspect is that the drugs of abuse, they will target these areas, these projecting neurons, which is involved as which is mainly involving your dopamine neurons. Okay, and the one that is producing abuse or addiction have the addiction liability will activate this mesolimbic dopamine system, increasing the dopamine levels in these areas. Okay, so that the mechanism of abuse will be proceeding. So each of the addictive drugs, they have their own kind of specific molecular target. Okay, so they have their own way of uh, they have their own way of showing their abuse liability through actually working on the mesolimbic dopamine system to increase the dopamine levels. Okay, so at least three of those molecular targets have been known for different drugs. So these are your G protein coupled receptors. Next one is your ionotropic receptors or the ion channels, and next one is your transporters involving dopamine, which is called as the dopamine amine transporter. So, when you need to classify the drugs for abuse, so the drugs has been classified according to the molecular targets that it targets in this mesolimbic dopamine pathways. Okay, so first one, the drugs that activate the G protein coupled receptors are the drugs called as opiates. We all know that the opiates are the one which we know of having a highest of the potential of causing the abuse liability. Next is your cannabinoids and gamma hydroxybutyric acid, called as GHB, LSD, mescaline, and psilocybin. So these are also the drugs which are your causing your psychomimetic action. I hope you have been taught about these drugs in your psychomimetic drugs. So next group of classification includes the drugs that bind to the ionotropic receptors or the ion channels. So the one is your nicotine, which is like mostly there in cigarettes and all. Okay, and alcohol, benzodiazepine, phencyclidine, ketamine. So ketamine is also a general anesthetic drug and is also exploited drug of abuse. Okay, and the one binding to the dopamine amine transporters are the drugs like your cocaine, amphetamine, which is also your sympathomimetic drug, and other club drugs like your ecstasy. So drugs has been classified according to the targets or the molecular targets which sorry.
Ma'am,
Yes, please.
हजुरले सेन्स गर्सेको त्यो मेजोलिम्बिकबाट
म क्लासिफिकेसनमा पुगिसके
त्यो मेजोलिम्बिकमै छ म्याम स्लाइड चाहिँ
अस्तिको जस्तै विन्डोज नगर्नु हुने हो के हो यहाँ अहिले भयो
म्याम अघि भएको थियो म्याम अहिले भयो
अहिले चाहिँ आइ एम अन द क्लासिफिकेसन अफ ड्रग्स अहिले देखिरहेछ
देखिरहेछ म्याम
Okay, then. So what was I saying was that your mesolimbic dopamine system is the main target of the drugs, and in these areas you have different molecular targets for the drug. So one is your G protein coupled receptor, next one is your ion channels, and the third one is dopamine amine transporter. So according to this, your drugs of abuse has been classified accordingly. Okay, so I have enlisted the name of the drugs, like this is your classification of the drugs of abuse. So drugs that activate your G protein coupled receptors are drugs like your opiates, and psychomimetic drugs like your cannabinoids, GHB, LSD, and mescaline. Whereas your drugs that work through your ion channels are your nicotine, alcohol, benzodiazepines, and the drugs that bind to transporters are that is your dopamine amine transporters are your cocaine and amphetamine, like that. So we'll come to the individual drugs. Okay, so we have already known so much about the opiates, and these are mainly your analgesic drugs, but these are the group of drugs which has also the highest liability to produce abuse or addiction, and the most abused one amongst the group are your drugs called as morphine, okay, heroin. We all know about the drugs. So codeine and oxycodone, these are like the most abused drugs under your opiates family. And if you are to rate the risks of addiction out of 5, okay, so they have the risk of getting abused or addicted is about 4 out of 5. So that means they have the highest of liability to cause the abuse amongst the opiates. So now slide change भएको छ. Is the slide change or it's in the same previous slide?
भइरहेछ म्याम
Okay, so that means I'm not allowed to show the full screen then, you know. Full screen ma show गर्दाखेरि something goes wrong just this. So never mind. So what was I saying was that for the opiate group of the drugs, so this is like your, I said that the mesolimbic area dopamine system is the prime target of the addictive drugs, and this originates in the region called as your ventral tegmental area. Okay, so this is the area where it originates. It usually lies in the brainstem. Now what is happening is that your dopamine, the main thing that your drugs of abuse do is that it increases the levels of which neurotransmitter, is involved?
डोपामिन
Dopamine, है ना? So dopamine, you see, this is kind of controlled by your GABA neurons. Okay, so can you see it in the figure, or it's too small to see?
देखिरहेछ म्याम
Okay,
अलिकति जुम गर्यो भने अझै देखिन्छ
so is that fine?
यस म्याम
Okay, so you see the dopamine is the action or the action of the neurons, dopaminergic neurons is actually controlled by your GABA neurons here. Okay, so the drugs that activate your G protein coupled receptors, let's say it as class 1 drugs. Okay, so this includes your opiates, GHB, LSD, and all. Okay, so in the VTA, that is your ventral tegmental area. So action of the group of this drug is actually on this GABA neurons, okay, which is acting as your local inhibitory neurons. So you can say that dopamine is under your constant inhibitory action through your GABA neurons. Okay, this is the interneuron which is controlling the action, kind of activity of the dopamine neurons. So they are under inhibitory effect of the GABA neurons. Okay, so what is happening is that with the use of class 1 drugs like your opiates, THC, and all this, okay, so they act on the GPCRs, that is your G protein coupled receptors present in the GABA neurons. Okay, and these are inactivated. Okay, so inactivation of these neurons, which is causing the inhibitory effect on the dopamine, will lift off the inhibitory effect of the GABA neurons on the dopamine. So this inhibitory action on the inhibitory effect is known as your disinhibition of dopamines, because of which now your dopaminergic neurons will be free, and they will be releasing the dopamine into the areas of nucleus accumbens, and we know that this system will be the one which is mainly involved in the reward system, which is the main mechanism for the drugs to show their abuse potential. Are we getting the point? What is happening here, Banera? Is that clear?
Yes, ma'am.
Okay, so your dopamine is under constant inhibition inhibitory effect of the GABAergic neurons. So you inhibit bhairako huncha haina, but with the use of your drugs of abuse like your opiates, now they will cause the inhibition of this GABA neurons. Okay, so this inhibition of your inhibitory interneurons called the GABAergic neurons will lift the inhibitory effect on the dopamine, because of which now dopaminergic neurons will start releasing the dopamine into the other areas of the mesolimbic dopamine system, like in nucleus accumbens, and this will give the reward processing action in these areas, because of which the drugs are therefore causing the abuse potential. Okay, so more clear will be in this figure where you see this is a uh, GABAergic neuron, which acts as a local inhibitory interneuron. So they have this MOR. Okay, MOR means your mu opiate receptors. We know that opiates they act through three different kind of receptors, that is mu, kappa, and gamma. Uh, sorry, delta. So these receptors are opiate receptors are present on those GABAergic neurons, which are your G protein coupled receptors. Okay, so they cause inhibition of this neuron, so that your inhibitory effect on this dopaminergic neurons will be lifted up, because of which dopamine will be now released into different areas of like your mesolimbic dopamine system. Okay, so one way of doing it is by inhibiting the calcium channels. Okay, that is a G protein coupled receptor linked to calcium voltage gated calcium channels, and the other way of doing is by through the hypopolarization. Okay, so both ways what is happening is that your GABA neurons are is being inhibited through the use of these drugs. Okay, okay. Am I clear?
Yes, ma'am.
So for the opiates, so knowing about the pharmacology is not enough. Okay, we also need to deal with the uh, treatment strategies that are there for the kind of your relating to your drugs of abuse. So for the opiates, okay, opiates addiction or the abuse ko lagi चाहिँ we have several drugs that are that have been used as the treatment. Okay, so for first one is your naloxone. So I hope you remember this drug. Okay, so this is the opiate antagonist, and this is mainly used in the poisoning cases of the opiate, but it is can also be used in the addiction kind of to treat the addiction of the opiates. But for the accurate treatment, okay, your long-acting opiate drugs like your methadone and buprenorphine. So these are your partial mu opiate agonist group of the drugs. These are often substituted for your shorter acting drugs like your morphine or heroin or cocaine, you know. So के हुन्छ भन्दाखेरि with the use of this longer acting drugs, okay, your एउटा कुरा त the methadone uh, because it caused the slow and persistence nature of action. Okay, the a capability of giving that euphoric feeling with the use of this partial agonist group of the drugs will be very much less intense as compared to your shorter acting drugs like your heroin, okay, or the morphine. And because of that, when you kind of replace this group of the drugs, that is methadone, buprenorphine, when you replace it with the heroin, so first thing is that the euphoric action will be less intense. Okay, and then we kind of give withdrawal of these drugs, and because of that because this causes the less intense, because they have only the partial action on the mu receptors or other receptors which mediate the euphoric feeling, जसले गर्दाखेरि चाहिँ नि withdrawal symptoms are less addictive and less intense हुन्छ, because of which the treatment of the addiction is very much easier with the use of this group of the drugs. Okay. Is that okay? So naloxone is mainly used in the poisoning case. That is because it is a pure antagonist. And for the addiction, okay, it can be used as a substitution therapy. The drugs called as your methadone and buprenorphine, which are longer acting, and these are your partial agonist with the receptors, because of which they give lesser intense feeling of euphoria as compared to the morphine. त्यसले गर्दाखेरि पनि abstinence can develop, and after like your 1-2 weeks of therapy पछि these drugs are withdrawn, and when they are withdrawn, the withdrawal symptoms also are less intense and less addictive. Okay, so in that case, we use drugs like methadone and buprenorphine. So next drug under the same group is your cannabinoids. Okay, so these are also your powerful psychoactive substances, which are psychomimetic drugs. This comes through the name called as hashish. Okay, so these are all the one that gives the euphoric feeling and all. So here also, so here also, okay, this group of the drugs, the cannabinoids, also acts through the presynaptic inhibition, like that of your opiate receptors. Okay, they have their receptors in the presynaptic neuron, that is in the GABA neurons. They have GABAAR, that is your GABA A receptors, that is present in the local inhibitory interneuron, that is the GABA, and cause the disinhibition of the dopamine neurons, because of which they cause the activation of the dopaminergic neurons and release the dopamine, and therefore gives that euphoric feeling. Okay. So next, again, the drug is your GHB, that is your gamma hydroxybutyric acid. So these are also popular by the name of the club drug, liquid ecstasy, and day trip drug, because of their high because these drugs produces the strongest feelings of euphoria. Okay, so they are again, this targets the separate group of the receptors called the GABA B receptors. Again, there is in this, the mechanism is that they cause presynaptic inhibition of the interneurons, that is your GABA neurons, so that the dopaminergic neurons are activated and release the dopamines into the mesolimbic dopamine system. Similar are the drugs called as your LSD, mescaline, and psilocybin. Okay, so these also are the drugs which works through the similar mechanism. Now coming to the next group of the drugs that bind to the ion channels are the group of drugs called as nicotine. So these are kind of exploited mainly through the smoking cigars or cigarettes and all. Okay, so this occurs primarily through the smoking of tobacco. So can you see in the picture there in the slide? So let's
Yes,
say, these are your class 2 group of the drugs. Okay, the drugs that work through your ion channels. So these ion channels are located on the neurons, dopaminergic neurons itself. Okay, so this kind of activate these channels, okay, ion channels, that is in the dopamine neurons itself. So mainly your nicotinic acetylcholine receptors are the one ion channels that are expressed in the dopamine neurons. And when this group of drugs, like mainly your nicotine or ethanol, they excite this kind of dopaminergic neurons, okay, they will be releasing the dopamine into the nucleus accumbens and other areas involved, like your prefrontal cortex, and therefore with the release of the dopamine into these areas, there will be this will be the mode of action, because we all know that now that the addictive drugs, they are main mode of mediating their abuse action is through the release of the dopamine in the mesolimbic dopamine system. Okay. So, for the treatment of this drug of abuse, that is nicotine, which occurs primarily through your smoking habits, cigars, cigarettes, or tobacco. So, nicotine itself is used as a replacement therapy. So, what is there is that it especially helps in people who is in need to quit smoking, okay, and it usually uses the products that supply low doses of nicotine, okay, so that the same kind of kick or euphoric feeling, you must have heard about the nicotine patch or even chewing gums, you know, are usually used in those form of the products to kind of help the people to quit smoking, okay. So nicotine itself is used in those forms which are slowly absorbed, like that in the form of chewing gum, or they can be even found in the products like nasal spray or transdermal patch. Okay, so that this slow absorption of nicotine is there. Okay, so that the same kind of kick or same kind of euphoric feeling is not provided. And also when these kind of products in the form of chewing gum or in the form of transdermal patches are withdrawn, they are uh, they are bound to produce less withdrawal symptoms. Okay, and the main thing is with the drug called as varenicline. Okay, varenicline is the drug that is coming from a plant extract, cysteine. Okay, so these drugs are actually your nicotinic acetylcholine receptor antagonist that is present on the ventral tegmental area. So this since these are the antagonists to these receptors, okay, they will prevent the nicotine from binding to these receptors, and therefore the effect of producing the euphoric feeling is not obtained. Okay, so these are actually your drugs that are used for the treatment of the nicotine addiction. And also there is a drug called as bupropion, which are also anti-anxiety drugs that you must have learned in your anti-anxiety classes. Okay, and these are the one that are also used for the cessation of the nicotine addiction. Again, your non-competitive nicotine receptor antagonist, and when withdrawn also they give lesser withdrawal symptoms, which makes the process of de-addiction much more easier. So next is the alcohol. Okay, so the abuse with the alcohol is a very serious public health care problem because of the many diseases that is associated with alcoholism. Okay, and mainly your liver is the main target, where apart from having those adaptive changes in the brain itself, okay, they are also made targeting the important organs in the body like the liver, where which is getting destroyed through the consumption of alcohol. Okay, so the pharmacology behind the abuse has been very complex, and it has been known that there is an inotropic receptor called as ENT1 that is located in the dopaminergic neurons. Okay, so this has been found to be the target ion channel that is responsible for the rewarding effects. Now, for the treatment of the alcohol abuse or the addiction, these are mainly supportive actually. And your for the supportive treatment, your benzodiazepines like oxazepam and lorazepam is used. But for the total like de-addiction process, okay, it's kind of your both. You need to involve both your treatment with the drugs for your physical de-addiction and also for your psychosocial approaches. And the drugs that are used are the drugs called as your acamprostate. Okay, so these are your NMDA receptor antagonist, which have the GABA A receptor agonistic activity, which is actually your inhibitory interneurons. So your control over dopamine for the release of the dopamine is inhibited. One of the drug is acamprostate. Next drug we know that disulfiram gives a kind of complex symptoms when used with the alcohol. Okay, your So this is another drug that is used, and also the drug called as naltrexone, which is used in your opiate de-addiction process, is also used for the treatment of the withdrawal from the alcohol abuse. So coming to the drugs that bind to the transporters are the drugs like cocaine, amphetamine, and ecstasy. So MDMA. So cocaine. So this is again your opiate group of the drugs. So this is a very highly addictive drug with a relative risk of 5, which is 5 out of 5. Okay, so these are very highly addictive drug. So these are used in clinical medicine mainly as local anesthetic drug, and also to dilate the pupils in ophthalmology. But apart from that, use in clinics or practice, okay, these are because these are bound to produce a very high abuse liability. So this will be the major concern here. Okay, and for this, no specific antidote has been developed so far for the cocaine addiction. So how will they work is that so this is your dopaminergic neuron. Okay, so what they do is that they inhibit the dopamine transporter. Okay, so dopaminergic neurons, they have the dopaminergic neurons, they have dopamine transporter, which is taking back the dopamine back into the neurons after the work is over. Okay, but with this drug called as cocaine, okay, they will be inhibiting this transporter so that the recycling of the dopamine back into the dopaminergic neurons will be inhibited. That means your dopamine is going to remain in the synaptic cleft for the longer time. Okay, so this increases the dopamine concentration in the mesolimbic dopamine areas, mainly your nucleus accumbens. Okay, and this causes the rewarding effects, and that's why they have the highest potential of getting exploited for their euphoric feeling. Okay, am I clear? So these are the drugs that are working through your dopamine amine transporters. They are inhibiting the dopamine transporters. Okay, am I clear? Is
Yes,
that understood? Okay, so similar is the other drug called as amphetamine. Okay, so amphetamine, we know that this is also your indirectly acting sympathomimetic drug. Okay, so what they do is that uh, they cause release of the endogenous biogenic amines. So we are mainly concerned here with the dopamine. Okay, so what is happening is that the amphetamine, it acts as the substrate for your dopamine transporter. Okay, so this is the drug which is the substrate for dopamine transporter. So amphetamine will be taken along uh, 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 inside through your dopamine transporter. So once inside, they will be interfering with the vesicular transporter. Okay, so they will interfere with the vesicular transporter and now cause the release of the dopamine from this synaptic vesicles. That means it is going to deplete this synaptic vesicles of their neurotransmitter content, that is dopamine. So indirectly, it is not going to directly go and cause the release of the dopamine from the kind of your dopaminergic neurons, but what they do is that they itself are going to be taken up by the dopamine transporter. So once inside, they will now interact or interfere with the activities of your vesicular transporter, and with that they will cause the release of deplete this vesicular synaptic vesicles with the dopamine and cause the release of the dopamine. Okay, and this is going to increase the levels of the dopamine in the synaptic cleft. Okay, and again we know that all addictive drugs, they have to work by increasing the levels of the dopamine in the mesolimbic dopamine system, and with this action they are going to increase the level of the dopamines, which is because of which they are producing the euphoric effect or the feeling of addiction and all with the drug amphetamine. So next is your drug called as ecstasy or MDMA, that is methylene methamphetamine. So these are kind of compounds which are related to amphetamine. So your actions are very much similar to amphetamine. Okay, the way they work will be actually like that of the amphetamine. But the thing is that they also work through your serotonin transporter. I mean, like. Because the amphetamine was the one which was having the highest of this affinity for the dopamine transporter, but these drugs, group of the drugs, MDMA, they also have the affinity for the serotonin transporter, because of which your serotonin levels repetitive administration, your serotonin depletion is going to be there, which causes neurotoxicity. So, summing it up, it all in the form of the table. So, we are mainly concerned over here is what we are mainly concerned over here, rather than the mechanism of action of the drugs of abuse, is that what are the drugs of abuse and which drugs are used for the treatment of those addiction. Okay, so for first of all, there is a drug, okay, called as naloxone. So these are mainly used for your opiate overdose or opiate poisoning, because these are the pure antagonist or non-selective antagonist of the opiate receptors. So next is the drug called as naltrexone, which are again the antagonist of opiate receptors, rather than used in opiate poisoning, because compared to naloxone, they are longer acting, okay, and also they are orally active, because of which they cannot be used in emergency situations. They are rather reserved for the maintenance drug or maintenance drug of opiate poisoning, because they are they are having or showing the longer duration of action and also orally active. So it also prevent the relapse. So after successful the addiction treatment, okay, with the drugs like methadone or buprenorphine, there is high possibility that the person on the abuse may return back to the addiction. Okay, and to prevent that, also we need to prevent the relapse. Okay, and for that, your naltrexone is the one which is used, and this is the drug also used for the treatment of alcoholism. So we have talked of methadone and buprenorphine also, that these are used for the opiate dependence, okay, as a substitution therapy. Okay, so because they have the slow and persistent nature of action, the feeling they produce will be less intense compared to the morphine or heroin, okay, which is your shorter acting, which is the one mostly exploited drugs under your opiates family. Because of that reason, the person is not likely to return to your use of methadone or buprenorphine so often. And after the substitution therapy, they are withdrawn. And while withdrawing these drugs, also the withdrawal symptoms that we get is lesser intense, and because of which these two drugs are mostly preferred as the substitution therapy for opiate addicts. Is that clear?
Yes,
Am I
ma'am.
clear? So this is about the opiates. Okay, so next one is for the nicotine. So nicotine is the one which is working through your ion channels. Okay, so they directly act on the ion channels of the dopamine neurons and helps in activating the dopamine neurons to release the dopamines in areas of your nucleus accumbens and all, which is a mesolimbic dopamine system. So here the drug called as varenicline is used, which is your nicotine acetylcholine receptor antagonist. Okay, these are mainly used for smoking cessation. So what is the other drug that is also used for the nicotine addiction or smoking addiction? What was the other drugs that was used, which is not mentioned here?
Cysteine.
So cysteine is the plant extract from where your varenicline is derived. So nicotine itself is used, for the cessation of the smoking. The nicotine is used as a itself is used in the people who are kind of trying to stop smoking. Okay, they will supply this nicotine in a very small concentration in products like your chewing gum or transdermal patches or even in nasal spray. Okay, so they tend to give like your slow absorption hune bhakoले same kind of feel or the kick is not derived from the low doses or the slow absorption of the nicotine. Okay, so nicotine itself is used, and the other drug is the anti-anxiety drug called as bupropion. Okay, so for the alcoholism, okay, alcohol de-addiction, this is called the term that is used, that is a delirium tremens. Okay, so this kind of onset of confusion usually caused by the withdrawal of alcohol. If you talk of a person who is trying to quit alcohol and he or she have withdrawn from alcohol, okay, it will give a kind of onset of confusion or feeling of confusion, like shaking movement, shivering movement, sweating, hallucinations, and also this is collective term to define those things that is getting from the alcohol withdrawal, which is called as delirium tremens. So to calm the person, okay, so the benzodiazepine group of the drugs, like your oxazepam, can be used. Okay. So next is your for the treatment of alcoholism, another drug called as acamprostate is used, which is your NMDA antagonist, which is your antagonist for the NMDA receptors. So this drug is used for the treatment of alcohol. And apart from that, what were the drugs used for the treatment of alcohol?
Disulfiram and naltrexone.
Yes. So the other drugs used are your disulfiram. You know about the disulfiram reaction where the person experience a lot more kind of inconvenient and uncomfortable reactions with the use of the drug disulfiram, because of which the person develops aversion towards alcohol. And the other drug is your naltrexone, which is your opioid receptor antagonist used again for the treatment of alcoholism also. Okay. Okay. So this is all that should be there with the drugs of abuse. So rather than knowing about the mechanism of action, this will come, I think, only as like your MCQs related question where you can be asked about different drugs that is used for the treatment of the drugs relating to abuse. Okay. Okay. Questions, so. Any questions? No questions?